All right, good evening, everybody. Hope you're doing well, and welcome to the November 9th Board of Health meeting. At this time, I'll do a call to order, and when I call your first name, if you would please state your first and last name and that you're present for the meeting. So I'll start. Marty Trotter, present. Courtney,
Courtney Austin Wilson, present.
Robert,
Robert Brown, present.
Carrie,
Carrie Hampton, present.
Hope,
Hope Haywood, present.
Julie,
Julie Mabe, present.
Lynn,
Lynn Richardson, present.
Mac,
Max Summy, present.
and Amy.
Amy Williams, present.
Okay, thank you. Next on the agenda is the public comment period, and we had no public comments, so we'll move on to the third item on the agenda, and that's recognizing one of our members. So I'll turn it over to Susan.
So tonight is Lynn Richardson's last meeting with us. Lynn served 3 consecutive 3-year terms. So Lynn has been on our board for 9 years. Does it feel like that, Lynn?
Oh, it might be you, but doesn't to me.
She's been a outstanding member, and we most appreciate her service to public health in Randolph County. And we just can't thank her enough for taking all the time that she's taken and all the work that she's done to support us. So Lynn, we have a plaque that sits in appreciation of your outstanding service to the citizens of Randolph County while serving the Randolph County Board of Health. And thank you so much. Lynn and I have been friends for a long, long time, longer than we want anybody to know right now, because then you know how old we are. But it's been a pleasure for me, and I hope you've enjoyed being on our board.
Oh, I have enjoyed it a lot. I hope I've contributed as much as I've learned, because it's opened my eyes and I've learned a lot. And the board is just composed of some great individuals. So I'm sure everybody will keep up their good work. I'm going to miss it.
Lynn, I'd like to say too, I appreciate all the support that you've given to the board and for the public health. You've always been real supportive of everything that's gone on here. You've provided feedback when we needed it, and you've supported us along the way. So I appreciate all your years of service to this board, and hopefully you won't be a stranger and we can see you around sometime.
Thank you. If you need volunteers or something, just give me a call. Might be available.
Thank you. All right. Next on the agenda is approval of the minutes for September 14, 2020. You should have those in your packet. Do I hear a motion to approve the minutes as presented?
I move to approve the minutes as presented. Robert Brown.
All right. Do I hear a second?
I second that motion, Courtney Austin Wilson.
Okay. Are there any discussion? All right. At this time, I'll call your first name. If you'll state your first and last name and let us know how you vote. Marty Trotter, aye. Courtney,
Courtney Austin Wilson, aye.
Robert,
Robert Brown, aye.
Carrie,
Carrie Hampton, aye.
Hope,
Hope Haywood, aye.
Julie,
Julie Mabe, aye.
Lynn, Mac,
Max Summy, aye.
Amy Williams. Oops,
Amy Williams, aye.
Lynn, we didn't hear your voice, but if you
Oh,
vote of your head.
I did say aye.
Okay. All right. Thank you. All right. Moving on to the agenda, the next item is the fiscal year, the 2019-2020 annual report presentation, and Tara Aker will step up and do that part.
Hey, everybody. Can y'all hear me okay?
Hey, Tara, you're just fine.
Told Susan this morning, even though we're public health, I sure am missing the fried chicken tonight. Normally, this is our covered dish dinner. In the last couple of years, we've had fried chicken from Snyder Farm. Anyway, so late last week, probably late in the day on Friday, y'all probably received an email from me with the Randolph County Public Health Annual Report for fiscal year 20. along with the supplemental appendix for each program area, laying out the performance measures. I hope that y'all have had time to review those, both of those, because I'm not going to go through those word for word tonight. I'm just going to highlight some of the highlights from the last fiscal year, mostly focusing on how COVID-19 impacted the services of the health department last year. I do want to start off by pointing out that in both the report and the appendix, there is one error that I found late in the day. So I will make that correction in the report and the appendix and send that back out to you guys. The error is in the clinic lab services. So that's when you look in the report under clinic lab, it says that the lab collected over 7,600 lab tests last fiscal year. And then in the appendix, there's a chart that talks about how many lab tests that we did. The numbers match, but we actually, there's one lab, it's the wet mount lab test. Those numbers were duplicated. And the reason they were duplicated is because a wet mount lab is there's one specimen collected, but there's 2 tests that are actually done. So we need to cut it in half and just count the one time that the specimen was collected. So like I said, I will make that correction and get that back out to you guys. And I just want to point out to anybody that may be watching this live stream that this report, once the corrections have been made, it will be posted on the public health website, on the public health data page of our public health website. The appendix will also be there, and that'll get up there, get posted sometime this week. Does anybody have questions about that error that was made? Okay. Normally we have our program coordinators as part of this meeting. They're not with us tonight unless they opted to watch the live stream. So as we go through the annual report information, if you guys have specific questions that Susan, Brooke, or I can't answer, I will get those answers for you and send the response to you via email. So just quickly, some of the highlights from last fiscal year. One thing that's not COVID related, as we went into fiscal year 1920, we knew that animal services was going to be transitioning away from public health. Well, in December of last year, that transition started, and our public health staff worked for the better part of the year and maybe into this year, working with animal services, working with county finance to make that transition as smooth as possible. But I think it's wrapped up completely, but that transition has happened and is complete. I will point out that, and you probably already know, that public health continues to work closely with animal services regarding the bites, the animal bites, to make sure that bites are properly followed up on, that folks that need post-exposure for potential rabies exposure, to make sure that that stuff is happening. So then there's COVID-19. As you all know, when COVID-19 arrived, it kind of turned our worlds upside down. But it did not close public health. We continued to provide services. And I just wanted to take a couple minutes and talk about how it impacted the services that we did provide. We have the case management programs, our CC4C, which is Care Coordination for Children, and our pregnancy care management programs that focus on working with high-risk pregnant women and high-risk children. Those programs, along with the WIC program, they work closely face-to-face with clients most of the time. When COVID arrived, all the face-to-face stopped, and it still continues to be that way. So all of their services, they've continued, but they've all been via telephone, remote. If somebody's needed resources, they've come on site and we've social distanced and put stuff outside for them to pick up their resources, like diapers or something like that. Our child care health consultant, who is always in child care centers, whether she's reviewing immunization records, providing technical assistance, that kind of thing, that kind of stuff stopped as far as in-person goes. She was reassigned to the Emergency Operations Center, where she continued to work with childcare centers, but it was more of a focus on COVID and how it related to childcare centers. I'm sure she answered other questions too when she's on the phone. Our clinic services were scaled back initially to help prevent the spread of COVID-19, but also because 3 of our nurses, 2 clinic nurses and our director of nursing, were pulled from their normal duties and were reassigned to the EOC. So clearly, when you don't have as many staff, you can't provide as many services. The lab services, even with our clinic services being scaled back, if you look at the numbers, if you compare the labs from last year to this last fiscal year to the previous fiscal year, we almost did as many labs. So the clinic labs stayed pretty busy, even with COVID, with the arrival of COVID. Our dental clinic services, you know, we hired a new dentist early fall of last year. She hit the ground running, got screenings done, was ready to start the referral process and get folks in for services. And then when COVID got here, that ground to a halt. And they, for a period of time, they were only doing emergency services. But I think towards the end of the fiscal year, we picked it back up and we're getting some of the folks in. You know, they donned the appropriate PPE and they started seeing folks again, and they continue to do that. Our environmental health programs, our food and lodging program, they kept plugging along when COVID got here. They were providing guidance. They were still going out and about. But as things progressed, we saw that the state was scaling back. The state actually issued a reduction in the frequency of inspections for some of the establishments, which gave them a break. So we sent them home for a little bit to keep them out of establishments, because the establishments that were remaining open were already stressed. They didn't need somebody else in there, and we didn't want our folks being exposed to something unnecessarily. So while they were out, they would reach out to establishments and share the most current guidance. They would go out on a complaint if a complaint came in. They did a lot of education, a lot of online education during that period of time through the FDA related trainings, which was part of if you read in the annual report, they participated again in the FDA program standards. And that's doing those online trainings is helping meet those standards. As COVID progressed, they eventually came back, and as the executive orders started coming out, they were often sent out into the field where we get complaints about executive order noncompliance in restaurants. We would get complaints, such and such restaurants not doing, they're not wearing masks, or they're not social distancing. And we would send environmental health out. Even though we didn't have authority to enforce that, we would send them out kind of as a courtesy and say, hey, this is what we're hearing. Please do your part to follow the executive orders. Our on-site wastewater program, they teleworked very briefly, but this program is probably the only program that had the least impact from COVID-19. If you look at their numbers are higher in 2019-20 than they were the previous year. So they were issuing more septic tank related permits, more well related permits than they did the previous year. So they didn't get to stay at home as much as some of the others did. Not that they were complaining. The only parts of their program that were directly impacted were the public swimming pool program. You know, with the executive orders being in place, public swimming pools were restricted on how many people could be in a swimming pool at one time. So some of those pools opted not to open this pool season. And then there was a period of time where tattoo artists couldn't be open for business. So they weren't out doing as many as inspections for those types of establishments. But this program, like the food and lodging program, they kept the establishments that they regulated up to date on current guidance, and went out and fielded any complaints that came in. The last thing I want to mention about the annual report is, if you read about public health preparedness, we talked about that prior to COVID, we were actually in the planning phases of our own exercise that was scheduled to be held in 2022, I believe. So we've been talking about that exercise for quite some time, but I don't know that you guys know, but our preparedness coordinator and some other staff, we regularly attended exercises to help prepare for incidents like COVID. Some of us attended a high consequence pathogen exercise last fall. I believe Dana and April, they actually attended a COVID exercise probably in February at Fort Bragg. So this is stuff that we're constantly working to prepare for. And now we're actually getting to do it. So we're hoping the state will let us count this as our exercise. I feel confident that they will, but I wanted to clue you guys into that. That's all that I have for the highlights. Did anybody have any questions about anything that I said or anything that was in the report? Okay. So I'll transition real quick into, I've been giving you guys a COVID-19 diagnostic testing update each time we've met. And since our last board meeting, Randolph County Public Health has had 1, 2, 3. We've held 9 testing events here on site, drive-through testing events on Fridays. And out of those events, we've tested 440 people. Community testing events, ones that we have arranged, and or StarMed has worked with municipalities to arrange. We've had 11 of those events. They've been held at the Soup Kitchen, the Archville Trinity Chamber of Commerce, Mount Nebo Holiness Church, City of Trinity's done it, the Town of Liberty has. The East Side held one at Central Gym. Technomark held a couple events. Creekside Park hosted an event. The North Carolina Pottery Center held an event, and then the RCC held an event. And we've tested 400 people at those combined. We've got 5 pending events. We've actually got a Northgate Commons event tonight, and from what we're hearing, it is there was traffic out on the road early on, so there's a big turnout for that event tonight. We've tried to schedule an event at Grub Family Y in Archdale. Thursday, there's one scheduled for Thursday. This is the 3rd event, but it's looking like rain. It ran us out yet for a 3rd time, but we're going to see. I'm working with Jared Bird to, he's my personal meteorologist, so we'll see what he says tomorrow about whether we can keep planning or if we need to cancel. And there's an event next Wednesday, the 18th, at Creekside Park from 4 to 7. And then I got an email at the end of today that the Town of Liberty, they have scheduled 2 events, one on November 14th and one on November 21st from 10 a.m. to 2 p.m. at the First Baptist Church. So we're excited that they initiated that. I actually spoke with, let me back up, StarMed and NCDHHS, they've partnered and they're wanting to have some regular testing events like Monday through Friday, regular events that people can just drive by and see it and they can just pull in and get tested. They don't have to wait for a testing event, or they don't have to go to urgent care or another facility. So we're working to find locations that are willing to do that. And thanks to Hope, she's put us into contact with Dr. Shackelford at RCC, and he is eager to help us. He has offered for us to use both parking lots at RCC here in Asheboro, the RCC parking lots in Archdale. So I'm going to reach out to his Director of Safety and Emergency Preparedness in the next day or 2 and hopefully work out the details there. So that's an update on testing events. Does anybody have questions about that? You want me to just move into that? All right, so April Wilburn, when we left, she's of course, our nursing director, and normally she would be here to present to you the communicable disease report, but April is probably still at the EOC entering COVID-19 case information into the COVID-19 database. So I told her I would be happy to give the communicable disease report. So far this fiscal year, we are seeing an increase in cases of hepatitis A. Last fiscal year, we had 3 cases in Randolph County. This year, since July 1 till now, we have 32. Those cases are primarily among drug users. And just so y'all know, we have hepatitis A vaccine, and we're ready and willing to give it if anybody is interested in getting it. We partner with agencies like the Shelter of Hope. You know, we make them aware, hey, if you're folks that are coming in and needing your services, we're here to give them hepatitis A vaccine if you guys are interested in doing that. So we do work with those in the community to try to make sure those that need it get it. Let me just remind you, the folks that we're gearing the vaccine for, they have to meet certain criteria. They have to be in a certain risk groups, and those risk groups include folks who are using drugs, whether IV users or non-IV drug users, people who are homeless, men who have sex with men, persons with chronic liver disease, including chronic Hep B or Hep C, and then anybody that's incarcerated in a detention center. And they can get the hepatitis A vaccine no matter their insurance status. We're also seeing the continued climb of gonorrhea and chlamydia. So far this year, this fiscal year, we've got 196 cases of chlamydia and 84 cases of gonorrhea. Our folks, when the folks come in and they're dealing with them in the clinic, staff are educating them. They're making condoms available. Those are the efforts they're trying to get into place to try to help these folks, encourage them to have safer sex practices. I'm sure you guys have heard about, you've heard a little bit about flu, even though COVID's the headline news, but we are in the flu season, this flu season. And so far in North Carolina, we've had 1 flu-associated death. I looked at that today. And just real quick, Susan may tell y'all this, but she's probably going to give y'all totals. But since COVID-related cases, since July 1st, we've had the bulk of our COVID cases. We've had 3,035 since July 1. And of our 71 deaths, 41 of those have been since July 1st. Any questions about the CD report? All right. Thank y'all.
Thank you, Tara.
Yeah. This time we'll move into the Health Director's report by Susan.
So we, right now, to add to what Tara was saying about our positive cases, each week we get a report from North Carolina Department of Health and Human Services. We get data regarding where we are in Randolph County concerning COVID-19. You all probably get that information on their Friday report. Is that when they get it? At the end of the situation report you get on Fridays, we include that report at the very end so you can see that. Last Friday or last week, we usually get it on Wednesday. Last week we were at 9.8% positivity rate. And what that means is of all the testing that's done in Randolph County, 9.8% of those tests are positive. So it's the amount of positive tests for the volume of tests that we're doing. The goal is for that to be less than 5%. Now, back in, I should be able to remember this, I brought that. I'm gonna say, I know in August we were, but back in all of the month of September, we were below 5%. In October, we started seeing that number edge up and we were above 8%. And since the beginning of, I'll say the middle of October, we went up to about 9%. And now we're edging up toward 10%. when we look at the folks that are requesting testing and we look at the number of positive tests we've had in the last 2 weeks, we've had over almost a 40% increase in the number of positive tests that are coming back in the last 2 weeks. So we're definitely seeing a surge in cases. We've certainly had more deaths in the last couple of weeks. Though, and I mentioned this morning on our crisis management team meeting, the good news is we know way more about coronavirus now than we did in March and April and May. So if you are diagnosed with a severe case of coronavirus and you have to go to the hospital, the chances that you'll die are far less now than they would have been early on, because the physicians and the nurses know more how to treat you when you get there if you have a severe case. We have more tools in our toolbox now than we had in the beginning. So we are, things are improving in that respect quite a bit, but we are seeing more spread of coronavirus. We currently have 6 outbreaks. That includes an outbreak at our detention center. We've got 6 staff members and 33 inmates that are positive at the detention center. We have an outbreak at Westwood Nursing Home, Crossroads, Universal, Woodland, and Claps, and Alpine. At one time, we only had a handful, like 1 or 2. So this again is another sign that things have sort of, the spread has grown. Today, we learned that we have a cluster, which is 5 or more cases in a community setting at Foster Street Church. So we are seeing at Foster Street Wesleyan, we are seeing a cluster there. There's several cases within that church. And for it to be an outbreak or a cluster, those cases have to be epi-linked. There has to be a connection. So for example, at the church setting, all the positives that came in today were all together at church, and the same day we can connect them in that respect. The same thing with an outbreak at a nursing home or a congregate living situation like the detention center. In an outbreak, it only takes 2 cases. In a cluster, it takes 5 that are related. Let's see. We've got 14 people in the hospital right now, and again, 71 deaths. Our total cases when I left this evening for the whole coronavirus outbreak are up to 43,353 cases. So Tara was talking about operations at the Emergency Operations Center. I'm so thankful for the operations center that we have at Emergency Services Headquarters. That has been extremely helpful to us. We're all in a huge room. We're more than 6 feet from each other, but we're set up so that we can talk, and we know if somebody's got something going on and we hear that, we can go, oh, wait, I just talked to somebody that was in that same situation. Or somebody can say, I've got needs over here. This family needs food, and they only have enough to last them for 1 more day. And this is like Thursday, which is when it always happens. And we figure out how to get them food for the weekend. So it's worked out extremely well. It's been a real blessing to have that opportunity. Because things are moving faster now and we're getting more cases, last week, Tara and April and I had a meeting, and we've had to move our work assignments and how we operate around. So we've reassigned some staff to assist April and Crystal, who are doing a lot of the NC COVID database stuff. We're going to pull in somebody else to help them. We requested today 3 case interviewers from the state. The state works with, have to say it, CCNC. Community Care of North Carolina is the vendor that works with the state to provide case investigators and case managers. we are going to need help. So we've requested 3 case investigators from them to help us today. So just so you know, we're having to move things around to keep up a little bit. Hopefully that'll be fine. Tomorrow we have a conference call at 1 o'clock with the state, which we always do every Tuesday, but this call is a little different. It's usually an hour. They've extended this call to an hour and a half, and it is about vaccine distribution. And we're being told that most likely we will see some vaccine maybe in December. That vaccine will be targeted toward populations that are most critical to what we have going on with the pandemic. It will go first to healthcare settings, those individuals who work in healthcare settings, whether they are in a hospital, a provider setting, whether they are pharmacy staff or ancillary staff. They're important for the functions of that healthcare setting. They might be EMS personnel, public health personnel, school nurses. They could even be technology support. So, you know, you can't run a hospital or anywhere anymore without infrastructure, computer, IT infrastructure. So those will be the number one critical targeted population. And then the next population will be long-term care facility residents, individuals with underlying conditions, those that are over age 65. Then it will go to the marginalized populations, people in correctional facilities, those who are experiencing homelessness or living in homeless shelter, college students, and then those in our rural communities, those who have difficulty accessing health care. So that is they've tiered these populations so that we can get the vaccine out where it's going to be most helpful in a most thought out way, I guess. You know, you've got to have healthcare providers to take care of people. Without them, it doesn't matter if you've got the vaccine, you can't, you know, so we've got to take care of those people first. How much vaccine we get will be dependent upon how much CDC, the federal government, decides to send us, we're told. We won't be able to request a certain kind of vaccine. I imagine most of y'all heard today that Pfizer says that their vaccine has proven to be 90% effective, and that is wonderful. That's exciting news. I have a feeling the vaccine we get first will be that Pfizer vaccine, and that is the vaccine that will require a booster 21 days later. So there will be two doses that will be required. And it is the vaccine that needs to be kept in an ultra cold storage. So minus 80 degrees Celsius, which is about minus 112 Fahrenheit. Vaccine will likely be distributed directly from the facility that manufactured it. And so we will have some challenges to meet in terms of, we don't have ultra cold storage like that, but we've already had meetings with the hospital. The hospital does have that kind of storage. We've already talked to EMS about assisting us with getting the vaccine given to our populations that are at risk. And of course, we'll have to pull, you know, I make no promises about whether or not we can keep our doors open to every service. In my mind, there is no more critical service right now than getting this pandemic under control and getting vaccine out to those who need it. And if we have to pull staff from other programs, we will do that, whatever it takes to get vaccine out to those who need it. So we've got partners lined up, and we are getting poised to get this vaccine where it needs to go. We've had several resignations in the last month, and it has put a stress on our team, particularly in the EOC. Our preparedness and lead communicable disease nurse resigned. She, we work people to death right now. I tell everybody we're working everybody's tail feathers off, but we don't have a choice. She has a family and wanted to spend more time at home with her children, and we certainly understand that. So we are looking for a nurse. So I'm asking you, please find us a good nurse to come be our communicable disease nurse. We plan to split that preparedness piece off from that nurse responsibility, and we're going to move that to a health education responsibility. That is a position that is oftentimes a function of health education, and we can certainly work that out here. 2 of our health educators also left us in the last month, and so we've reconfigured those positions. We've had our lead supervisory health educator has asked to step back from her management roles. So we've reconfigured that team. We're not going to call it health education. It will be population health and health policy. We are trying to hire a public health strategist who will be, we found our need to be able to provide clear, understandable, and timely data has been extremely important during this pandemic. And we have, Tara and the health educators have been tackling that job, but we really need somebody with some epidemiology background, somebody who has that vision for what, how to look at population data and inform us what the data is telling us. And so we have reconfigured that position to be a public health strategist, somebody who can look at epidemiological data, look at our populations in Randolph County, and help guide us to make the best decisions that we can based on what our population needs are when we have disease outbreaks like hepatitis A or a pandemic. So that position will be the management lead for our new health policy, health promotion and health policy division. And we will hire another health educator who will serve half her time or his time as a health educator, but the other part of their time will be a preparedness coordinator. So we're looking to hire those. I have actually have interviews set up this week for those the last 2 positions. We have excellent candidates for those positions, but we are still advertising for our nursing position. So if you know of a nurse who might be interested in doing some very rewarding work, and when we're not in pandemics, you typically don't have to work a lot of weekends or nights. We would love to have them put their application in. They just need to look online under HR, and the application should be there. So that's where we are with staffing right now. The only other thing I thought that I would mention is just so you know that we have made efforts, and we won't stop making efforts, though we're kind of going back and thinking about it. You should have gotten a draft resolution that I had submitted to the commissioner for the commissioner's agenda at their November meeting. And originally that was on the agenda, and then it was removed from the agenda. I feel like it will pop back up again, but I did want you to know we made that effort and that we'll continue to push forward with, leadership has to step up and say, these are the things. We know that there is not one single strategy that will get us out of this pandemic. testing everybody won't get us out of this pandemic. Isolating and quarantining everyone won't get us out of this pandemic. It takes a whole tool chest full of mitigation strategies to get us out of this. And leadership has to step up and say, I support public health. I support the mitigation strategies that are recommended. I am concerned about you, your family, and your well-being. And we are here to support you in any way we can to make this happen. So that is where this comes from. And as a public health leader, I would not be doing my job if I didn't make these requests of leaders in our community. So I did want you to know that. So I have hope that we will see some fruition, some results from these requests that we're making. So that's my report. Does anybody have any questions or comments?
I just have a question, not concerning what you said, but the vaccine that we give out for the flu, does that vaccine contain mercury?
Most
I
of
know
them
some
do.
do not, but
Courtney, I don't think it does. I think they have pulled mercury from a lot of vaccines. Dr. Brown, do you know?
Most of them still use mercury as a way of keeping the vaccine stable.
Do they? Okay.
Yeah.
April could tell you if she was here, but I'm sorry. I can find that out for you, though. I'm happy to do that.
I would appreciate it because I did want to, I know we got the flu shot last year there and it was my first time getting it. But as I do more research, I just want to make sure that the one I get this year from you all, if I do get it, then I would like it. I would like to know if it did have it or did not have it.
Okay.
So thank you. Thank you.
So I have a question. Oh, wait. Can you hear me?
Yeah.
Okay. I couldn't tell if I was muted or not. Listen, I've had about 3 Zooms today. I'm about zoomed out. With contact tracing, are we still finding the community to be cooperative with that, Susan?
Not especially, somewhat. But what we are finding a lot of times is people are getting tired of us calling them. You know, if it's a family and they have children, the schools have called, we've called. The folks I've got doing that kind of investigation now are getting, you know, not happy people on the other end of the phone a lot of times. So it varies. It's just according to the individual. Some of them are happy to tell us. Some of them are quite upset when we call them and say you were positive for coronavirus. So they're dealing with people that are frightened and afraid. But, you know, it just depends. For somewhat, people are sharing their contacts, but not a lot. They will tell us if they have family, but if they've been around anybody else, most times they don't want to tell us, those folks. I can just about tell you from what I see, you know, they will name their family members, but it's not as likely that they will name friends or others that they might have been around. And that's a choice. We can't make them do that. And again, that's why one mitigation strategy will not get us out of this. It takes all of them. It takes, you know, the masks, the social distancing, the washing your hands, planning how you're going to do things. You know, I was going to read this to y'all because it bothered me a little bit. We have, I had an email from somebody who had emailed me last week and was saying, where are those eco cabins in Randolph County? And Tara had seen these previously several months ago and had mentioned them to me. And I said, where are those? So we figured it out. They're over off Old Cox Road, and you can go to the website Getaway to find them. And I think Randolph County is the site. They're all over the United States, but Randolph County is the North Carolina site. These people got this as a gift from their daughter last year at Christmas, and they came to go to the Burkhead Mountain Wilderness, trail in the Ori Mountains and the zoo. And he sent me an email back today, and in his email, he says, we had talked a little bit in the email previously when he asked me about COVID and that kind of thing. And he said, hi, Susan, it is a beautiful time of the year to visit Randolph County and hike the Burkhead Mountain Wilderness. We also unexpectedly discovered a very nice hiking trail at the zoo. He said, on this field visit, though, I had a chance to understand the challenges you and your team are facing with public health. I learned that masks are optional at the grocery store and Lowe's Hardware in Ashboro and on the hiking trails where I expected this. That's really a shame, especially for the workers who can't keep their distance. Neither the store staff nor the public seemed inclined to ask the shoppers to wear a mask. It must be frustrating at times. Thank you for your work. And, I said to him when I emailed him back, I said, please come back and see Randolph County. It is a beautiful place and the people are wonderful. And I'm sorry that, we had people that put you at risk. So we won't keep asking for that. But again, that is the impression that we're making on visitors when they come to Randolph County.
I just wanted to make a comment. I had talked to Tara. Tara's been talking with me the last 3-4 weeks. The drive-through testing that you all have over at the health department works so superbly well. I mean, those girls just are fantastic at what they do. Got tested there myself. And I was so impressed of how everything just flowed, everything moved, and there was no slowdown. Job well done.
Great, thank you.
I just have to say that I was disappointed for the resolution to be taken off the agenda. I know there were at least 2 of us that had really strong feelings about it. But we all know it's been politicized. COVID has been politicized, and because of that, then we've lost the public. And if we don't do something to get them back on board, we're going to have a mess on our hands. I try to wear mine everywhere I go because I feel like it sets an example. I feel like as a leader, as a member of the Board of Health, it's important to set that example. When I was a teacher, I felt like I set an example. So I feel that way. That's a carryover, I guess, from my teaching days. And I just feel like our public officials, our leaders, people like all of you, we just need to talk to as many people as we can, try to gently educate them to wear those masks and to do the social distancing, to stay out of large groups, to adjust holiday plans accordingly, because it's real. My dad has COVID and Parkinson's. So we don't know what the week holds. He's at Crossroad. They've done an exceptional job keeping it out. But when it becomes extremely widespread, then that increases the chances of those workers who go in and out of getting exposure and bringing it in. So the last time I saw my dad for an in-person visit, we stayed 6 feet apart. It was over a week ago, and I wore a mask like I'm supposed to. And I wore the mask because I thought I was protecting him. But the person I was probably protecting was me. So I just shared that. I know all of you folks are healthcare people, and you understand it even better than I do. But we must get the message out. The last I heard, there were 6 workers at Crossroad just in the memory care center alone. So when you're down 6 workers in a long-term care facility, the ones that are there are absolutely fighting to take care of the people that are there. And then the last I heard, there were 10 residents. And that's a lot. Most residents who were there have dementia or Alzheimer's. So you think about taking care of those people, that population with COVID. And it's a mess. I think part of the reason they were able to keep it out for so long, they've done a good job, but I think it was not so widespread in the community. And when you get up to 9, almost 10% positive rate, then your healthcare workers, your first responders, your EMS people, they're going to be getting it. And who's going to look after the rest of us who get sick?
With the resolution that is being presented to the Board of Commissioners, would it help at all if we as a board decided to support that resolution and vote on that tonight to support the resolution going before them?
I think it would. I also think it would help for
I think for the community too.
yes. I also think it would help for you folks to go to the Randolph County website where it says contact a commissioner and contact a commissioner. Any email that you put there, please support this resolution. You know, whatever you say, it will be shared with all commissioners. And they need to hear it from somebody other than the 2 of us that have talked so much about it. The other commissioners need to hear it from you. They need to hear it from community members because that's what they respond to. Why do you think they didn't put it on the agenda? That was a response to community that had seen or heard about, I'm sorry, this is my dad. Susan, talk and I'll be back. Hello?
Yeah, Dr. Brown, I think that, I think there will be I have heard there is a resolution, not particularly this resolution. It is a combination of this resolution and some other pieces that someone else who supports us is going to present at the next meeting, perhaps. But I think it would be nice if, or appropriate rather, for the Randolph County Board of Health to say, you know, something to the effect that you support county leadership. How would we do that?
I don't know. We may have to go the email route to the commissioners because this is not on the agenda, and I'm not sure
Right.
we can change the agenda at this point, but what Hope just stated, that might be a way that we can share our support of any resolution, whatever it may look like, if we agree to it, that we email those commissioners, let them know our thoughts, and make sure that you let them know also you're not only a community member, but you're a Board of Health member. So that might be the appropriate way at this point to.
Yeah, if someone could draft like a letter and then email it to all of us,
Yeah, we can do that.
that would be fantastic. It's been publicized too, and saying that this is like the flu. It is not like the flu. I tested negative twice. I guarantee I had it. I had all the symptoms. I felt like I was dying for 5 days. I couldn't get up off the porch. All I did was sleep. If I got up to try to drink, I slept for 2 hours because I was so exhausted just getting up to drink. Fevers lasted 5 days. Loss of smell, loss of taste, hallucinations. You name it, I had it. Talking to other people that I have at least 6 people that I know right now are experiencing those exact same symptoms. They've all tested positive. They're all healthcare workers. They've all practiced PPE, and we still came down. It is not like the flu. It's taken 3 weeks for me to recover from when I initially came down with this. And thanks to Tara, because she got me in touch for my second testing, which also tested negative. But thank you for everything you do at the EOC and all you're doing for the COVID stuff. It's phenomenal. This county far outdoes what I'm seeing done in Guilford or Forsyth or Davidson. We're way ahead of the game. So thank you so much for what you do.
Thank you, Dr. Brown.
Okay, any other comments?
That's my dog commenting in.
Guys, I appreciate your time tonight. I want to say a couple things about Susan and her staff. As you tell from her report tonight, they're under a lot of stress. Staff's under a lot of pressure. They're going elsewhere. I don't know that I can say that I blame them for the amount of hours and time that they're putting in. Families are just as important, more important than a career or a job. So it's very important that they make the decisions based on what they need to do as individuals. And so I certainly hate to see them leave, but I certainly can respect what they're doing. So I know over the last few months, couple months anyway, that this public health department and the Randolph County school system have worked extremely close together on a number of cases. And so we've tried to do our best to protect our students, our staff, our communities, our families. And so without Susan's support and her staff support, we wouldn't be where we are today. And certainly I think we've given a valiant effort. And so we continue to try to do that. We continue to try to maintain some sort of semblance of school for our students, because I do think it's very important for kindergarten through 12th grade that they have exposure to their friends, they have exposure to their teachers, and not just sit behind a screen and be able to do homework and classwork. That's extremely difficult. We're seeing all kinds of issues as a result, I think, of not being able to be among their friends, their peers, and their colleagues. And so it's a very stressful time. So with Susan and her group, I would say thank you again for all that you do. Guys, it may be time that we treat them again to something, because their staff's under a tremendous amount of pressure. And so with the holidays coming up, that might be something that we want to consider doing for the health department here, as well as the EOC, and support them in some way and show them our support and some sort of small token, just to say thank you for all that you're doing, and we appreciate what you're doing. So if that's something you guys are interested in, please email me, and we'll try to put something together. Lastly, I want to say, Lynn, again, thank you for your service to this board. It's hard to believe the 9 years have gone by so quickly. I know when I came on a few years ago, you were the first ones that reached out to me. I certainly appreciate that as a fellow board member. So thank you for your service to this board. Any other comments?
Susan, did you fill them in on what happened with the resolution?
I just did, I feel pretty confident there'll be another resolution that is not the one I did, but a combination of this one and another one that might show up at a later meeting, and to just hold on. And so Dr. Brown had asked if we would just draft a letter for
Okay.
you all to send to the commissioner's email, and we'll do that.
My sense was not opposition to the resolution, but the governor had come out a week or two before, and Dr. Cohen, asking for counties where there was a higher rate of positives for the counties to consider enacting some measures that would be more restrictive than what he has in place. And I think a couple were worried about pushback from that. That word had gotten out, and so one of them was already having some conversations with some clergy, which there's just a lot of misunderstanding there, I think. But anyway, I think it was pulled because they wanted to wait until after the election. To be honest, I think that's what was driving it. So maybe we'll be able to get something done now that it's getting so bad. Maybe it's going to open their eyes, and we'll be able to get something done to get the attention of the public.
Okay, anybody else? Thank you, Hope. Okay, if there's no further business, we'll, do I hear a motion to adjourn the meeting?
I, Robert Brown, make a motion to adjourn the meeting until the next meeting on January the 10th, 2021.
We're gonna have to get you a correct date. I believe that's a Sunday, so we're not gonna meet on Sunday.
I thought it said January the 10th in the email.
Yeah, we'll get you the correct date.
Okay.
Okay, we have a motion to adjourn. Do we hear a second?
Julie Mabe, second it.
All right, Julie, so this time I'll go around the room. I'm Marty Trotter, say aye. Robert?
I, Robert Brown, say aye.
Courtney?
Hi, Courtney Austin Wilson, say aye.
Carrie?
Carrie's muted.
Carrie Hampton, aye.
Hope?
Hope Haywood, aye.
Julie?
Julie Mabe, aye.
Lynn?
Richardson, aye.
Mac?
Max Semi, aye.
And Amy?
Amy Williams, aye.
All right, guys, we're adjourned. Thank you.
See you next year.
Lynn,
Bye,
thank you so much.
everybody.
Yeah, Lynn, we're gonna miss you.
Aye.
Bye, Lynn.
Welcome. We'll try to stay in touch.
Please do.
Yes.
Bye, y'all. Have a good rest of the week.
Thank you.
Too.
Bye-bye.
Bye-bye, Lynn.
Did I miss calling Mac every single time? Have I been calling Mac?